Low volume per puncture with no pressure, it is important.
I'd like to thank Dr. Ali Otto in particular for this, giving me a chance to be one of the members here, and I think it's a very nice city. My talk today is about cardiac rehabilitation. Can you tell me by the show of hand, how many of you have cardiac rehabilitation in your hospital?
CVD, including stroke, is a #1 killer. It costs 40% of total mortality.
My name is Ivan Shashenkov. I have honor of representing Moscow State University of Medicine and Dentistry and the Russian Scientific and Methodological Center for Clinical Use and Research of External Contour Pulsation. I would like to present you the results of our clinical trial, which was devoted to use of enhanced external contour pulsation in patients with stable ischemic heart disease and obstructive sleep apnea. This trial, very first time was presented at European Congress of Cardiology last year in Barcelona and published in the results of the study was published in European Heart Journal. Let's start with the background of our study. Sleep apnea and ischemic heart disease. There is a significant correlation between ischemic heart disease and sleep apnea and ischemic heart disease. There are several significant mechanisms of pathological action. Sleep apnea in cardiovascular.
For today, I need a short story because my son get some problem. I try my best to talk. For the topic is today is good way to improve the cardiac rehabilitation.
And I'd like to thank the people that recommended my name to the organization. It's great to be here in Antalya. It's a beautiful city. I would like to share with you my history with EECP or ECP, whatever you like to call it. EECP is for life. One of the signs of aging is organ shrinkage. EECP prevents organ shrinkage, and I'm going to go and tell you how that works. That's the earliest time anybody could ever think of using EECP. I used it clinically. The reason why I used that, because I was the head of an intensive care unit, and I read an article in JACC written by Azra Amsterdam. He is right now the chairman of cardiology at the University of California, Davis. He wrote an article postulating or hypothesizing is that if we increase the diastolic pressure during the coronary artery perfusion, we limit the size of the infarcted area. So if somebody coming with an active myocardial issue like crescendo angina or pre-infarction or cardiovascular episode that is something eminently will happen. Therefore, if we increase the perfusion of the coronary artery during diastole, we limit the size of the infarcted or prevent the infarction. Achieve the same benefits of EECP. So if we combine ECP with exercise, we are the winners. Statin, there is a gentleman, a professor that was sitting here, asked, how do you know, doctor, that the results and the benefits?
I have the opportunity to go on a lecture here. My title is Enhanced External Compensation in Cardiac Rehabilitation, maybe in China. We are talking about what is enhanced external compensation. From the expert's opinion in the morning and afternoon, I learn more about the mechanisms of ECP. But I think we should have deep investigation about the mechanisms of it. And the mechanisms of exercise rehabilitation. And third, we should talk about the advantages of ECP in cardiac rehabilitation in special population in China. And finally, we should present some cases by clinical practice. The new science into ECP, the air bag inflated and deflated, just like the effects of the muscle bundle. And you can see here, when the ECP is working, the arteries will be compressed sequentially, and which propel the bike go back to where it comes from, and give the vital organs such as brain, kidney, and heart the second time to be perfused. And simultaneously, the veins in the legs are also be compressed, and the bloodstream will be propelled back to the right ventricle, and so that the circulation is promoted at greatly extended.
Everyone speak a paragraph.
Okay, we're ready. Let's start.
Start.
So, greetings from Antalya, from the 14th Congress of Update in Cardiology and Cardiovascular Surgery. Now there were really great two sessions, a meeting which was devoted to use of enhanced external compensation, and we are ready to tell you some words about our impressions from this great event. My dear colleague, my dear friend, you will be first.
I'm very glad to have the opportunity to take part in Congress of this kind. It is so amazing that given the opportunity to meet you.
Thank you so much.
I think your work is collaborative.
Thank you so much. I believe we'll do it. Thank you.
Thank you.
And your impressions?
Yes, I'm honored to join this conference, and I have the entire presentation from Dr. Shashenkov. It's very nice, helpful, and valuable. And welcome to Antalya, and your valuable presentation would be a great help for us in our next step and in the future of our promotion, the ECP technology, and teach the people about the heart rehabilitation. Yes, I think the topic here is very good. very nice time with you here.
Yes, I think there are many work should be done because the ECP mechanics is not uncertain.
Yeah.
Even we have to do more and more work of this kind. So just like I tell you in the afternoon, I hope I have the chance to invite you to China. Please, you help us to do that. Yes.
You're welcome. Yes.
Thank you, friends. Thank you for your attention, for your impressions, and for these warm words. I believe we will collaborate to our together great results in the future, and to propagate, to develop the clinical use of ECP in many clinical areas.
Yes. We have seen many good results, just like the work you have done. But I think we can do better.
Yeah. Do better in the future.
We can do better.
I believe. So, greetings from Antalya.
Yes.
Thank you so much.
Thank you so much.
Thank you so much.